All right. So thank you again for joining the September 2025 edition of the monthly Marketplace Connections meeting. My name is Amy Coven, and I am the Communications and Public Engagement Analyst here at the Marketplace. Here I'll go actually go on camera so you can see me. I'm happy to be presenting the content here for you today and giving you a little bit of a deeper dive of the monthly marketplace updates that we share at the regional collaborative meetings, hopefully answering your questions and providing some additional information and answers if you had anything lingering after those meetings. So the first thing that we wanted to discuss is I think the hottest topic going around right now, which is the federal changes that are impacting the marketplace. The first thing that I want to mention is that we do have a document that we recently put together for our partners called Provisions of HR 1 and 2025 Marketplace Program Integrity and Affordability Rule. We do have that document is available online, and we'll go ahead and drop a link to that in the chat. Miranda, Caroline, or Michael, if you don't mind doing that, there's a link in the updates that we can paste in there. That document does go into greater detail about each of these provisions, the effective dates, the kind of the contingencies and ins and outs of each of these, and kind of all the things that you need to know. So I just wanted to call your attention to that document because it is definitely going to be helpful for you as we are helping clients here, especially during open enrollment. So I'm going to just go year by year. I went ahead and broke out this content a little bit more than we did in our monthly updates. Break it out year by year for you and just kind of talk about the different changes and where we're at right as of right now. I do want to just remind everyone that we're in a constantly evolving situation and landscape. Things are changing all the time, and we do anticipate that that will continue to be the case. So, the document that we have put together for you, we do have a date on there as far as when it was last updated. You'll want to make sure to access that document online if you need to. If you need to reference it and make sure that you're using the most recent version, and we will let you know whenever we do keep that updated. There's some court cases going on right now that are impacting some of these things, so just want to call your attention to that as well. So for 2025, we only have really one major change, I would say, and that is the change for DACA recipients. As you hopefully know, DACA recipients did become eligible for marketplace coverage on November 1st of 2024. However, the 2025 Marketplace Program Integrity and Affordability Rule did remove DACA recipients from the list of eligible immigration statuses for marketplace coverage and also for basic health program coverage as well. So what that means is that effective August 25th of this year, new enrollees were not able to get coverage through the marketplace or through or OHP Bridge, which is Oregon's basic health program. And then for Marketplace, the Marketplace will be automatically disenrolling all current DACA recipients who are enrolled through the Marketplace on as of October 1st of this year. So we have been told that the Marketplace has sent letters to each of the current enrollees that are impacted by this change. I will let you know that we do not have any data as far as how many people are impacted in Oregon through the Marketplace. And we did not get contact information from our federal partners to be able to do outreach on a state level. So we are relying on the federal side of things to do all of that outreach. And like I said, they did advise that they sent out a notice. They did give us a copy of that notice. Unfortunately, we're not able to share it. But that's where we're at. And as far as I'm aware, because we do work very closely with the OHP Bridge side, they are also going to be disenrolling the OHP Bridge enrollees. There's I think about 75 enrollees that are impacted that will be disenrolled around the end of the month as well. So more, just wanted to kind of make you aware of that. Again, this is something that we've kind of been talking about for a little bit of time, so hopefully this is not new news for you. Um, but definitely important to be aware of. Let me find the right screen here. I've got a lot of screens open. Okay, so this slide has a lot of information on it. So bear with me because it's going to take a little bit of time to go through. Um, but I do want to make sure that you understand each of these bullet points and how they impact enrollees here in Oregon. So these are all things that are going to impact the 2026 plan year, or that people are going to feel in 2026. The first thing that I want to call your attention to, that first bullet point, is not actually a provision that was included in HR1 or the Marketplace Program Integrity and Affordability Rule. We included it because of the fact that it is sunsetting, so it is actually ending at the end of December 2025. And it's not included in any legislation or federal rules at this time. So, what that is the non-extension of enhanced premium tax credits. So, what this means is that the premium tax credit calculations are going to revert back to using the pre-2021 expected premium contributions. So if we think back to pre-COVID, the Affordable Care Act had, there was a chart of expected premium contributions, and, it varied depending on what your income is, which is similar to now. But the biggest difference is that if you were over 400% of the FPL, you were not eligible. You were expected to pay your full premium. And then once COVID happened, and the American Rescue Plan Act was passed and went into effect, that reduced that expected premium contribution level for each enrollee. So for every federal poverty level, it just reduced that EPT or EPC amount. And then for people at 400% or more, it actually gave them a percentage for that expected premium contribution. So it made it so that everyone was potentially eligible for premium tax credits. So by this expiring, what this means is that enrollees are going to be expected to pay more towards their premium because they're going to be receiving less in advanced premium tax credits. This is a very high impact for every marketplace enrollee. Every marketplace enrollee who receives premium tax credits is going to pay more for their coverage, assuming that they keep the same plan. The increases for enrollees at about 200 to 400% of the federal poverty level are somewhere between $90 to $165 per month. And then older enrollees over 400% of the federal poverty level could pay up to $900 more per month. So again, this is something that we're going to see during open enrollment this year. I do want to mention that there is a lot of talk on a federal level. You might be seeing that floating around in the news about the government budget, and Congress is really talking about, whether they're going to expand excuse me, I'm sorry, extend out these enhanced premium tax credits. So there is some talk about that, and it is possible that they will be doing that. The questions that we have are they going to do it at all? Are they going to do it before open enrollment starts on November 1st? Are they going to wait until closer to the end of the year? There's a lot of kind of what if scenarios. So our window shopping tool is going to be updated, so we'll have the correct calculations, assuming that it does revert back to the standard expected premium contributions. And then if it gets extended out, then we will pivot and we will update. I'm seeing some comments. Um, okay, I think we're good. No questions. I don't think we have any questions yet. Okay. Any questions on that? Because I know that's a big topic. All right. So the second bullet point here, ending of eligibility for premium tax credits for non-citizens under the 5-year bar. So some non-citizens are not going to be eligible to receive premium tax credits on marketplace plans. This provision changes the definition of lawfully present to exclude some previously eligible non-citizens. So non-citizens who are not quote unquote eligible aliens will be able to purchase plans through the marketplace, but cannot receive premium tax credits. So this is going to apply to most non-citizens who are not green card holders, so who are not lawful permanent residents. It is going to include refugees and asylees. Again, because we do not have direct access to data, we do not know how many enrollees in Oregon are going to be impacted. And this is going to start for uh, excuse me, this is going to start for the 2027 plan year. I'm getting ahead of myself and I'm uh, giving you a head look on the next one. Um, let me So that's actually next year. We are this year, sorry, just one second here. Okay, so this year what's happening is that non-citizens with incomes under 100% of the federal poverty level who have been in the United States for less than 5 years. So basically folks who are under the 5-year bar are going to be able to go through the marketplace and purchase coverage, but are not going to be able for not be eligible for premium tax credits. Sorry for the confusion. So that's what's actually kicking in here this year. Again, we don't know how many people this is going to impact in Oregon, but we really think that this is going to be pretty low impact for Oregon because these folks again are under 100% of the federal poverty level. So typically here in Oregon, they're going to qualify for OHP benefits through the Healthier Oregon program. So we're a little bit less concerned about this. I think we're a little bit more concerned about the expansion of this restriction that's going to happen next year, which extends it out to more of these kind of what I was talking about before, more folks like refugees and asylees, regardless of how long they've been in the country. So that's a little bit more of kind of what we're looking at. Any questions on that? Okay. Um, okay, so the changes of actuarial value of plans. Um, so basically what that means is that carriers are going to be able to offer lower quality plans. This could impact the amount of premium tax credits that individuals qualify for if silver plan premiums become cheaper in response to poorer benefit design. Most plans use a higher actuarial value, and premiums are driven by network. So we don't think this is going to have a big impact here in Oregon. This is effective technically for plan year 2026, which means the plans that were already filed in summer of this year. However, there is a court case, the City of Columbus versus Kennedy, which does is currently placing a stay on the rule pending a final ruling. So We are kind of waiting to see what the results of that are, if there's going to need to be last minute changes to the plans, more to come on that. But as of right now, we're just kind of on hold waiting that final court ruling. And then the change to premium adjustment percentage methodology, we also don't think is going to have a big impact here in Oregon. This changes how the premium adjustment percentage is calculated, which enables CMS, the Centers for Medicare and Medicaid Services, to set a less favorable maximum out of pocket and deductible amount. So this can influence the back end of premium tax credit calculations that is used by the IRS. Again, we don't think this is going to really impact Oregon very much because the way that we use plan design is really to mitigate those high deductibles. Um, and again, if regardless, if the enhanced premium tax credits end, then the way that the premium tax credit calculations are changed are not going to be as apparent because of the changes to the premium tax credits already. So again, we don't believe that this is going to make a huge impact here in Oregon, but it is something that's on our radar. The next bullet point here, the failure to reconcile allowance reduced from 2 years to 1 year. So what this means is that people who received advance premium tax credits who did not reconcile taxes in 2024 must reconcile in 2025, or they will lose advance premium tax credit eligibility for 2026. So again, we think that this is going to be low impact because most individuals file their taxes and, when they go through the marketplace and they lose APTC, they're generally going to go back and fix their taxes so that they can get their APTC. So we don't think this is going to have a huge impact. Also, this is included with that court, excuse me, the court case, City of Columbus versus Kennedy. So it is stayed pending the final court ruling. So it's not necessarily going to take effect this year. We're kind of waiting to see what happens. But depending on the results of that court case, we may see that take effect this year. And so it is something to be aware of. But again, we don't think it's going to have a huge impact. The message really is still needs to be, make sure you reconcile your premium tax credits every year. It's something that folks have to do. It's something they agreed to do in the application. So we just want to make sure that they're continuing to do that. Okay, so the increased income verification standards. Again, this is part of that City of Columbus versus Kennedy case, so it is stayed pending the final ruling on that case. What this particular provision will do is it will require individuals to submit documentation to verify their income before enrollment if the IRS systems are unable to verify their income automatically. This provision primarily impacts lower enrollees who are likely eligible for OHP Bridge, so we don't think it's going to have a huge impact. However, some folks may lose premium tax credits or coverage if they do not act quickly and they fail to provide proof of income. So the biggest takeaway here, again, we do currently it's on hold, so we don't know if it's going to take effect for sure for this open enrollment. But what we do want to take away is that folks really need to pay attention to their notices. And if they're asked for any sort of documentation, they should take action as soon as possible. We really need to make sure that folks are minding the due dates on their notices and what documents need to be submitted, and really making sure that we're calling that out when we're helping them so that they know for sure. And then speaking of verification standards, we have a pre-enrollment verification for special enrollment periods through healthcare.gov. This requires healthcare.gov to verify enrollment eligibility for at least 75% of special enrollment period enrollments for consumers who are not already enrolled through the marketplace. So basically, up to 75% of folks who are applying and seem to qualify for a special enrollment period, will need to submit verification documents to prove that they qualify for that special enrollment period in order to go through and complete their enrollment. This again, we don't think will have a huge impact. Some folks may experience a gap in coverage while their documents are received and processed, but most special enrollment periods do not require significant information to verify eligibility. And this particular provision does not apply to state-based marketplaces. So if this does, again, this is part of that court case, so it is on stay. If it does take effect this year, as it's supposed to, then we would really need to only deal with it for this year. And it's not currently scheduled to continue on after this year, and it doesn't impact Oregon after we launch our state-based marketplace. So again, we really don't think this is going to have a huge impact on Oregonians, but it's something to be aware of. And I just want to reinforce, I think it's just really important that we make sure that folks are really being mindful of what's included in their notices, what the deadlines are, and things like that. So changes to premium payment threshold calculation. What this means is that um, the insurance carrier, it changes the premium thresholds that insurance carriers are allowed to offer. So currently, insurance carriers can accept premiums that are slightly less than the full premiums to prevent their coverage from terminating. But this rule changes how insurance carriers are allowed to calculate that threshold. Currently, though, insurance carriers are not required to use a threshold, and the requirement is only for 1 year. Um, so this provision could cause some burden for insurance carriers whose thresholds don't meet the new requirement, but the burden is not likely to be significant. So again, we really don't think this is going to have a big impact on Oregon. You'll notice that there's a recurring theme here. Most of these things we don't think are going to have a big impact on Oregon. But again, it's something to be aware of. And it's likely to impact more on the carrier side of things than it is on the consumer side. Um, and then denying coverage for past due premiums. So this allows states to choose whether to allow insurance carriers to require past due premiums to be paid before coverage is effectuated or before it's made active. Um, Currently, we already have some insurance carriers that require past due premiums to be paid. So this really should not impact consumers who are re-enrolling in the same plan, because they would be required by or covered by the 3 month grace period, and it really shouldn't impact anything here in Oregon anyway. But again, it's just something to kind of be aware of. Again, this is also included in that City of Columbus versus Kennedy case, so it's on stay. So it may not even take effect this year. But again, just kind of something to have on your radar. Standards for termination of insurance agents agreements with healthcare.gov. I know this is probably perking up some ears of our insurance agents. CMS will establish stronger standards of conduct for insurance agents enrolling consumers directly or indirectly through healthcare.gov. I do want to mention that this should have a very low impact here in Oregon. Or here in Oregon, the insurance agents that we work with are already very highly regulated and monitored in partnership between the marketplace and the Division of Financial Regulation. Any complaints of improper or fraudulent enrollments have not been received, and impact to enrollees or insurance agent is really not anticipated at this time. So again, we're really not concerned about this. We know that we've got a really good group of insurance agents working here in Oregon, and we anticipate that this is really something that's written for other states and for states that are having more issues with improper or fraudulent enrollments. Just not something that we're really seeing here, thank goodness. And thank you. Um, Another hot topic is gender affirming care not being allowed as an essential health benefit. So this provision removes gender affirming care from the list of allowed essential health benefits. I do want to remind everyone that Oregon state law does require that gender affirming care is covered by all plans, and that requirement does remain in effect. So gender affirming care will continue to be covered by every plan offered here in Oregon. We do not anticipate any changes to benefits, premiums, or cost sharing. Um, Basically, the plans are just going to be adjusted to compensate. And again, we just really don't see an impact here in Oregon. This you'll see this will already be built into the plans here for this year. And again, we don't have any concern here in Oregon because we've already kind of taken preemptive action by writing that Oregon law to include gender affirming care in every plan. So we are ahead of the game. The special enrollment period for folks at 150% of the federal poverty level or lower is paused for 2026. Um, this, again, this is really not something that we're too concerned about because most people who are at or below 150% of the federal poverty level are very likely eligible for OHP Bridge. So we have really not seen a lot of people take advantage of this special enrollment period. So we really don't think this is going to have a big impact or if any impact on Oregon. But just to be aware that that special enrollment period is not going to be available starting in October of this year through the end of next year. End of auto re-enrollment that moves consumers from bronze to silver plans. Again, we don't think this is going to have a big impact. Very few, if any, Oregonians have been moved under this policy. But this provision repeals an earlier rule that required healthcare.gov to move bronze enrollees to silver plans if the silver plans were the same or less expensive and offered the same provider network. This will be effective this year, but again, we really haven't seen this impact Oregonians so far, so we don't think it's going to, we think that it's going to continue to be really low, if any, impact for Oregonians. And then last on the list here is bronze and catastrophic plans or high deductible health plans. This provision makes all bronze and catastrophic plans high deductible health plans, which means that enrollees can contribute to a health savings account while enrolled in one of these plans. Um, we think this is going to be a very low impact to Oregon. Non-HSA bronze plans have a pre-deductible coverage and are a very better value for consumers. So being able to pair them with an HSA is actually a benefit to consumers. So low impact, but also what impact there is actually kind of a good impact. So yeah, we really just don't have any concern for this. Um, okay, so I'm going to pause because that was a lot of information for 2026. 2026 is the heavy one. So I just want to pause for a moment, ask my colleagues who've been monitoring the chat, were there any questions that came up? Is there anything that I should answer? And Tina, I'm more than happy to give you guys kudos because you all do great work. I'm assuming that that's what you were thanking me for. Okay. All right. So we will go ahead and move on. Sorry, got lots of windows open. Tina, thank you. So Tina's comment is yes, that's exactly what I meant. Thank you for understanding all the work we put into helping consumers. It's going to be hard and sad in 2026. And I know Michael's on here, so I welcome him to chime in. But yes, we empathize with you. We're there with you. I know that our team is definitely feeling that stress and wanting to help folks out as much as possible. So we're here to support you in any way that we can. And we really just do appreciate y'all being on the front lines of all of the difficult things that are going on. So thank you.
Yes, and just to reiterate what Amy said, spot on. So much appreciation for what y'all do, both the community partners and agents. So could not do this work without you, and I agree it could be a little sad at points. So we'll do the best we can for folks. Hi, Tina.
All right. Well, we'll get moving along to 2027, which is maybe a little bit less depressing for all of us. I'm sorry, guys. At this point, it's like, I gotta find the smiles somewhere. Okay, so removal of advanced premium tax credit repayment caps. This is going to be a pretty big one, you guys. And I want to make sure that everyone understands this because this is going to make a big impact, I think, just in the way that everyone reports their income on their application. We want to make sure that everyone is I mean, whenever someone's filling out an application, we want to make sure that they're putting things in as accurately as possible and that they're reporting their income changes and everything. But I think that with this particular change, that just gets even more crucial. So, with this particular provision, it removes the repayment caps for consumers who do not accurately report their income on their marketplace application. So, for example, consumers who report their income lower on their application than what is reported when filing their taxes will owe back all of the excess advance premium tax credits that they were not eligible for. We do think that this is going to have an impact here in Oregon. We hope that it's not going to be a huge impact, but we do anticipate that there will be impact. Folks who report their inaccurate income or who do not update their income throughout the year could need to repay a substantial amount on their taxes. And consumers who should have been enrolled in Oregon Health Plan, but kept their marketplace coverage will have to pay back the most. So that's not to say, I just want to clarify here that that's not to say that if someone if they make a mistake and they just slightly overestimate their income and they actually should have been on OHP, that's not what we're talking about. What we're talking about is if somebody wanted to keep their marketplace coverage, so they overestimate their income and they report that their income is going to be higher because they want to keep their marketplace coverage, knowing that their income actually should put them in OHP range. When they go to file their taxes, the IRS is going to say, "Oh, wait, your income's low enough that you should have been on OHP," and then they're going to have to pay back that financial assistance. So this is going to start in tax year 2026, which means that folks are going to start seeing the effects when they file their taxes in 2027. So that means that effectively means that this is for this plan year. So this is going to start. So really, even though it's for the 2026 plan year, this is really something that we need to consider during open enrollment starting November 1st of this year. Um, so again, it's just really, really important that folks, try to guesstimate their income as accurately as possible. If they have income changes throughout the year, or if they see that their income is differing from what they guesstimated, that they go in and report that as quickly as possible. It's just going to be more crucial than ever because those repayment caps are not going to be there. Does anybody have any questions on this? Because this might be a little bit more confusing. Okay, not seeing any questions, so I'll keep going. Ending of eligibility for premium tax credits for refugees and asylees. I already kind of talked about that. So that's going to extend out the eligibility, excuse me, the ending of eligibility for premium tax credits specifically for folks who are not quote unquote eligible aliens, which includes refugees and asylees. They will still be able to shop through the marketplace, but they won't be able to get financial help. So that could potentially have a impact here in Oregon. I'll be really honest in saying that we don't know what the impact is going to be because we don't have access to that data. So yeah, I it's a bummer. I don't know. I'm sorry. And then the last thing on here is the shortened open enrollment period. This will impact Oregon, as you know, hopefully. We are scheduled to move over to our state-based marketplace for open enrollment starting November 1st of 2026 for the 2027 plan year. So we will be on our state-based system. However, this specific provision does impact state-based marketplaces as well. So this provision allows open enrollment to last no more than 63 days. It mandates that open enrollment must start no later than November 1st and end no later than December 31st of each year. So it also requires that any enrollees that enroll by December 31st have to have coverage starting January 1st. So that is a little bit of a benefit to consumers. So again, this does not impact open enrollment this year. Open enrollment this year will start November 1st, 2025, and will end January 15th, 2026. But when we have our first open enrollment for our state-based marketplace, we do anticipate that it will likely be November 1st through December 31st of 2026. So mark your calendars. Any questions on these 2027 provisions before I move on? Janet, if they pay back their premium, does that mean they will also have to pay back any services paid for by the plan? So Janet, I'm guessing that you're talking about the first bullet here, the removal advanced premium tax credit prepayment caps. I just want to repay I just want to make sure that we're on the same page. So they're not actually paying back their premium, they're just paying back the financial assistance portion, so the advanced premium tax credits that they got. So this is basically um, it's like if they over, if they got more tax credits than what they were supposed to get. And it goes both ways, right? If they got less premium tax credits than what they should have gotten, then they'll get a credit back on their taxes. Um, so it does go both ways, but this is basically just removing the cap. Currently, it says, if you're within this percentage of the federal poverty level, you will only have to pay up to, I think it's like $350 or whatever the limit is. Those limits are going away. So it's basically just going to be, you know, you got more than you should have, so you have to pay all of that back. So yeah, it's not going to impact the services, thank goodness. That would be a nightmare. Yeah, no problem. I'm happy to help. All right. Lastly, we'll move on to 2028. Um, and these are all the same, so that is not correct. So I apologize. So we're going to skip this. My apologies on that error. Okay. Well, we will get out of the negative Nancy section and get into something that's a little bit more exciting, which is training. Yay. Um, So open enrollment is coming up before we know it, you guys. It is already, if you can believe it or not, the end of September. I know that I am still just in a state of shock because I'm sitting here with a senior in high school and just can't believe that, September's already over. But October is going to be here in just a few days, and that means that your training is going to be due very, very soon. So if you are an assister, your training is due by the October 31st, and your training is offered here by the Oregon Health Insurance Marketplace. So you are lucky enough to be able to be trained by one of either Miranda, our very own Miranda Amstutz, or one of our fabulous outreach and education coordinators. We do have training available in person. We have live online training, and we also have an on-demand option, which you can take kind of at your own pace. Um, there are two different training options available this year, depending on your experience. Certification training takes about 6 hours live, and that covers the full gambit of all of the topics. That's best for new assisters or assisters who want, maybe aren't as seasoned with marketplace information and need a little bit more knowledge. We also this year are offering a recertification training. So if you have taken marketplace training in the past and you feel a little bit more comfortable and confident in the information, then you are welcome to take that recertification training. And that one is going to be a little bit shorter. I will let you know that basically the difference between the two is that the recertification training takes out the application section. So that's basically what's being pulled out there. But there is a link here on the screen so you can find a scheduled training. And I know that Miranda is working with the team to see if we can get some more live training scheduled. Miranda, is there anything else that you wanted to add on that before we move over to the agent side?
Nope, I think you nailed it. If there's ever any questions, just please don't hesitate to email the cp.marketplace email inbox, and we're happy to assist.
Perfect. And then this is actually a little bit updated information from our monthly updates this month for our insurance agents and brokers. So all of our insurance agents and brokers are still going this year. Okay, this is your last year, hopefully, of going through training by CMS, the Centers for Medicare and Medicaid Services. You do still need to take that federal training. It is required for plan year 2026. CMS did just recently, I think I want to say the beginning of this week, release information for their training for plan year 2026. And it is available in RegTap. They did send out information via RegTap for all of the currently registered insurance agents and brokers. So definitely check your email, check your junk and spam folders if you didn't see it. And if you didn't see the email or you just want to go directly to get the information, I've got a short link on the screen here. We do ask that you get your training completed as soon as possible or by October 31st. I know many of you also help with Medicare enrollment, so I would say probably before open enrollment for Medicare starts would probably be easiest for y'all. Um, but definitely the good news is that it's finally available. And Michael, is there anything you want to add on the agent side?
No, I think that's perfect. Yeah, just like as Amy said, this year again, CMS going to be through the MLMS system. Should have an email, I'm sure, from RegTap if you're registered previously. If you don't see something, get logged on and get that done so you can get that one thing checked off your list. But no, I think that's perfect.
And I do want to say, I think, I don't want to speak for Michael, but I know on my side of things, at least, I'm very excited to be able to switch y'all over to the state-based training because I know the CMS training system has never been super fun. I remember doing that I remember having to go through that and it was never great, but we've gotten really great feedback from our assisters and I'm just really great. I'm really excited to switch y'all over. I think you guys will appreciate the state training a lot more. Not to toot our own horn or anything. Any questions on training? All right. Hopefully, y'all are already done with that. All right, moving on to I would say probably the most exciting update that we have for you, which is our state-based marketplace project. And this month, we actually have an update, which is very exciting. I know that we've been, probably sounding like a broken record for the last, I don't know, 8, 9 months, saying, oh, we're still in the procurement process. We're still in active procurement. But the good news is we're not in active procurement anymore. We finally have a signed contract and we have a vendor and Man, I wish I had a button that I could push that went, yay. Um, but yeah, we have a solution vendor. It's Get Insured. That's who we're going to be working with. We have had some kickoff meetings with them, and we are officially now moving into the implementation stage of the project. We are working with them to finalize our project plans and timelines and, all of those things. And it's just, I can just speak for myself, but I know, the rest of the team, I'm really grateful to say that I work with a team that for, we've all been together for so many years. Maybe most of us have been here since we started the Oregon Health Insurance Marketplace, if not longer. And I think that we're all just like on cloud nine and almost pinching ourselves every day saying, "Oh my gosh, is it finally happening?" So yeah, we're finally in implementation. We're moving forward. Things are picking up speed. Um, do want to remind you though, as we are, continuing to plan timelines and engagement activities, we still need your help. We ask that you please continue to support Oregonians with gaining health coverage through the marketplace through 2026. So just a reminder that for the entire 2026 plan year, we will still be using healthcare.gov. We will not be switching over to our state-based marketplace until open enrollment, but the plans won't actually start until January 1st, 2027. So we are going to be on healthcare.gov through 2026. And then secondly, please take note of any questions, comments, or concerns that you hear from your clients or that arise in your office and share them with us. I shared a short link here on the screen. We've got a really brief form that you can fill out to share those with us, and I will personally get back to you with a response. But we really do want to know what's on your mind, what's on your clients' minds, even if you think it's really minor, because we want to make sure that we're addressing any concerns or hesitations or questions, as they arise. So definitely keep all that in mind. And just to kind of give you an idea on timeline, this is kind of where we're at. So we have submitted the CMS Blueprint Exchange application, the draft application. CMS has published that on their website. And as I said, we're working with Get Insured now on the detailed budget and schedule. And we are in the implementation phase, which will take us through to open enrollment of next year. And as you can see, we have a lot of things that will be that will be going on between now and open enrollment. There will be a lot of opportunities for you all to weigh in. And we just ask that you bear with us as we go through this huge change. Speaking of which, your feedback is super valuable to us. And I just, really hope that you'll continue to join us or maybe start joining us if you haven't yet for our listening sessions. If you're an assister, we do hold those sessions on the last Wednesday of January, April, July, and October. And then for insurance agents and brokers, they're the last Thursday of the same month. The next listening session topic is going to cover high level the implementation plan and timeline. We're going to talk a little bit about partner engagement opportunities, and I really want to get feedback from you all about at what points you all are hoping to provide input and weigh in on different aspects of implementation, so that we can take that into account and hopefully build in time for our partners to weigh in and provide input. So very valuable sessions. They've really helped shape a lot of things so far. We've had a lot of really great feedback come through and really great participation. But if you haven't joined, I encourage you to join. And if you have, then we encourage you to keep coming. And I'm the one who hosts those. So if you like listening to me talk, then you'll hear me more. And then we have multiple ways that you can give feedback on the project or stay up to date. We do send out a quarterly newsletter. If you haven't been receiving those, I encourage you to sign up for the newsletter. The last one we sent out was here in August. And then we also share updates and collect public feedback and committee feedback at the Health Insurance Marketplace Advisory Committees, which meetings which happen quarterly as well. We do have a project website in which we post all of our reports, our listening session results, and all of our newsletters, so you can check that out. And then we've got our frequently asked questions page as well. All right, last topic, and then we'll be about ready to wrap up. So just to give you an idea of the 2026 health plan landscape in Oregon, as far as overall health rates, they're not entirely final, but I will tell you that for the individual market, we are going to see an average increase of about 9.7%. And for the small group market, we're going to see an average increase of approximately 11.5%. And then we did want to give you an idea of health plan availability. For this year, every county in Oregon is going to have health plan choices from at least five insurance companies. So every company that offers plans in Oregon, except for Kaiser Permanente, is offering plans statewide. Kaiser Permanente is the only company that does not offer plans statewide. They do offer partial service in Benton, Lane, Lynn, and Hood River. And then they do offer service in, oh gosh, Columbia, Washington, Yamhill, Polk, Marion, Clackamas, Multnomah. Um, I think that's it. So, yeah, we've got a really robust plan offering network offering this year. So really excited. And then you're here at this meeting, which means you're registered already. We hope that you'll continue to join us last Thursday of every month. And then I just want to give a few minutes to leave some space to hear a little bit about what's happening in your community. At this point, I do want to, open the door if anyone wants to share, if there's any events going on. Is anyone planning any open enrollment events? Is there any like major concerns or things that are happening or coming up? I'm gonna make it so you can come off of mute. This is your time to share. Anybody? All right. Well, no pressure. I do want to remind everyone that our marketplace outreach team is still just constantly out in the field. They are attending events just all over the place all the time. It just continues to blow my mind how active they are going to events and networking meetings and making contacts and connections. So, if you haven't met your regional outreach and education coordinator, I encourage you to meet them. You can go to the short link on the screen and find out who your coordinator is. I encourage you to drop them a line, whether it's an email or give them a call. And I know that they would love to set up a meeting with you to learn more about what you're doing and how they can best support you. We also have a calendar on our website where you can go to see what events our outreach team is supporting. So I encourage you to check that out as well. And if you ever know of an event coming up in your community, or if you're planning an event, like for example, an enrollment event or anything like that, please feel free to reach out to your outreach and education coordinator, because our coordinators are more than happy to support you, and to whether it's promotion of your event, adding your enrollment event, for example, to our calendar so that more people know about it, sharing it on social media, or maybe even attending your event and helping you out. So, just we're here to support you. Speaking of, these are all of our outreach and education coordinators. So if you have not met your person, this is who you'd be looking for. And their contact information is on the web page that you saw on the last screen. And if you're looking for other ways to connect with us, we've got a slew of ways to do it. As Miranda mentioned, we do have an email box that's dedicated for our community partner questions, and then another email box directly for our insurance agents and brokers. And then we're very active on social media. So if you're not currently following us, we encourage you to. Always love it when our partners share, comment, or share our posts. We love to build that engagement, and we're always happy to share your information as well. And then lastly, I just want to mention that we do have a really robust resources page on our website where we have a number of publications you can download or order, and a number of other really great tools. So definitely check that out if you haven't already. And with that, that's actually the end of all of our information today. I feel like it gave you guys a lot. So if anyone has any questions, you're welcome to stay on, and I'm happy to answer them for you. Otherwise, I'm happy to give you guys some time back. Thank you, Maria, for coming. Thank you, Francis. It was good to see you again. Thank you, Tina.